The good news is we have not had an admission here at Ellis since the 21st of June, and since the 25th of June, we've had no inpatients. So since that date, we have been essentially COVID-free in terms of active cases at Ellis Medicine. And that does kind of mirror what we're experiencing locally in the Capital District. We kind of lead the state in the prevalence of COVID, that is in terms of percent positives on daily testing. Yesterday we were down to 0.1%, only 2 cases in the whole Capital District. So we're doing very well. All of us have heard about the Delta variant. The Delta variant emerged in India, spread to Europe, and is now becoming the dominant strain here in the U.S. The Delta variant is characterized by increased transmissibility, significantly so, and perhaps, maybe even probably, increased virulence. It has been spreading in some countries, predominantly among unvaccinated younger people. So those of us who are not vaccinated are at risk of becoming infected with the Delta variant and either getting very sick ourselves or more likely spreading it further. So I think the Delta variant does represent a risk for maintenance of COVID-19 within the population, and even with that circulation among the population, risk of further mutation which could compromise our ability to control this, I would say, pandemic going forward. Well, we know the vaccinated folks are largely protected from the Delta variant, especially as regards severe illness and hospitalization. What we don't know completely is that with asymptomatic infections, how efficiently will we spread the Delta variant. Right now, I think it is appropriate for vaccinated folks to behave as we've been instructed to, that at this point, masking is more optional in certain settings. That's the other question. What do you do if you're unvaccinated? And I think if you're unvaccinated, I think to maintain social distancing and masking in indoor areas, regardless of what local regulations may be, is very appropriate and clearly advisable. The Delta variant is out there. It may increase, and although not in the Capital District, within the state, we've seen a very slight uptick in the percent positives in the past couple of days. However, the best advice for those who are unvaccinated is to go ahead and get vaccinated. These vaccines are very safe and very effective. The danger from a vaccine side effect is extremely small and much smaller than actually getting infected with COVID-19. What we have seen, even in young people, is there does seem to be an increased frequency of severe illness in those who are getting the Delta variant at this point. And to make a conclusion that the vaccine is more dangerous than COVID is incorrect.